Good evening, everyone. We welcome every one of you to the WIGIL Webinar special episode on the surgical personality. And today we have with us Dr. Sanjay Govil, who will be speaking on the topic. And to moderate, we have Dr. Supriya Sharma. Dr. Supriya Sharma heads the HPB and liver transplant unit in the Department of Surgical Gastroenterology at SGPGI Lucknow. And she's been a big inspiration to all of us on how to start and run a good program. I'll now hand it over to ma'am to please introduce her.
Yeah, thank you, Manpreet. And thanks to all of you for organizing today's webinar. It's an absolute pleasure to invite Dr. Sanjay to deliver his talk on the surgical personality. Now, whatever ideas we might all have as to what constitutes a surgeon, I think Dr. Sanjay is uniquely positioned to share what he thinks are the traits which have helped him reach where we all aspire to be. So I don't think I need to introduce him to any one of us. I mean, we all know Dr. Sanjay. We have all heard him at all conferences. We have seen him. And somewhere we have all wished, do I have the guts that he has? So, Dr. Sanjay, would love to hear it from you. Please.
Well, thank you very much, Supriya. That's very kind of you. First of all, I'd like to thank all the powers that be behind WIGIL for inviting me for this. I have listened to a few before, and they've always been really interesting. So it was quite a challenge to try and think of something to maintain that kind of interest, and I hope that I am able to do so. I know it was supposed to be a case that made a difference, but the problem, after Shruti made that presentation of 100-pint blood transfusion, I mean, in comparison, all the cases that made a difference to me were like 20 years ago and are now all of you are performing absolutely routinely. So didn't know that I could give much lessons from that. So I thought of various topics, and this was one which has interested me. I started wanting to keep this fairly light, but it got a little bit sort of more dark. I read more about it and wrote. So I have written this out because it's not possible for me to say all this as well as when I write it. So if you'll forgive me, I'm going to be reading out what I have written. So when I was a medical student, I didn't like surgeons. Okay, I thought they were very loud, very brash, very prepared for anything that they set out to do. And so it came as a bit of a surprise to me when I found that I wanted to do surgery. Which really happened in my internship, and that's part of this story. So to start, uh, for surgeons of my generation, the surgical personality is a clearly identifiable trait. We could recognize with a high degree of accuracy which medical student would specialize in a medical as opposed to a surgical discipline. The stereotypical surgeon is epitomized by Richard Gordon's Sir Lancelot Sprague, who is this guy. I think some of you may have seen him on the Doctor movies. Um, Typically, the stereotypical surgeon has traditionally been male with a testosterone-induced swagger, confident, brash, charismatic, and commanding to the point of arrogance. He is volatile, even bullying and abusive. He cuts first, asks questions later, because to cut is to cure, and the best cure is cold hard steel. Sometimes wrong, but never in doubt, good with his hands, but has no time to explain. Compassion and communication are for sissies. Usually followed around the ward by adoring, almost lustful medical students and nurses. But he is also decisive, well organized, and hardworking. A 1991 study analyzed the personality of medical students, the personality of medical students, found that those who were competitive, aggressive, and highly confident ended up as surgeons. Then there is the woman surgeon, again, typically described as cold, impersonal, moody, a micromanaging shrew, a castrating harpy. I was interested to learn that surgeons number 5 on the list of professions with the highest number of psychopaths. Um, it was cold comfort to know that CEOs and lawyers score ahead of us. And the description of women surgeons is common to all successful women in positions of power and has more to do with the person using those words rather than the woman in question. There are, of course, some kind of descriptions of surgeons as well. We're probably familiar with the adage that surgeons must have the eye of an eagle, the heart of a lion, and the fingers of a lady, which has been, I think, falsely attributed to Aristotle. Another one which I came across was a surgeon should have a temperate and moderate disposition. He should have well formed hands, long, slender fingers, a strong body, not inclined to tremble, and with all his members trained to the capable fulfillment of the wishes of his mind. He should be of deep intelligence and of a simple, humble, brave, but not audacious disposition, well grounded in natural science, and should know not only medicine but every part of philosophy. So he is able to understand what is written, to talk properly, and to support what he has to say by good measure. This is attributed to Guido Lanfranchi. But not surprisingly, both these quotes are written by surgeons themselves. Now, every personality is multifaceted and complex. We all know surgeons who may have these traits in varying measure, but the stereotype needs to be accurate only some of the time for it to become a stereotype. So, how did this come to be? It probably began because physicians looked down on the illiterate surgeons of yore. Before the discovery of anesthesia, these stereotypical traits were necessary in order to function. Surgery at that time was often performed for uh, one second, for infectious conditions like gangrene. And it was performed in front of an audience with strong men holding the patient down, and speed was of the essence. No time to think or communicate. It was not unusual to have a 200% mortality. The patient and surgeon, if he nicked his finger from the gangrene, would also get septic, and there were no antibiotics, and so he would pass away as well. And in one celebrated case, even a 300% mortality. A patient, surgeon, and an observer who were all died following the surgery. Observers often fainted from the ordeal, a luxury not available to the surgeon. Instead, the surgeon had to put his last disaster out of his mind to do the next operation. But times have changed, even from when I trained 40 years ago. Although I thought poorly of surgeons as a medical student, I quickly realized during my internship that many of them were kind, thoughtful, effective, and went out of their way to help their patients, reflecting and agonizing over each decision they made. Truly, they attached themselves to the patient with the last stitch they took. I think the great majority of modern surgeons are of this ilk. Today, preoperative imaging and endoscopy ensure every patient goes to surgery with an established diagnosis and treatment plan, often defined at a multidisciplinary meeting. While the surgeon remains the captain of the ship, multiple specialties and disciplines are involved in patient care perioperatively. Rudeness and the throwing of instruments are no longer tolerated. Today, no patient undergoes surgery without consent, and then, after a clear and detailed discussion on what the operation entails, delivered with kindness and respect. The public now has access to information, demands quality, and does not accept preventable complications. The qualities that a surgeon needs have changed accordingly. So, are we no different than our medical colleagues? Indeed, we are. A recent study used a psychological test called the five-factor model. So this is the five, this illustrates the five different categories of psychological traits, which I'll explain. The five-factor model breaks down personality into five key traits: extroversion, which is a measure of sociability and a preference for company; agreeableness, which is one's tendency to be compassionate, caring, and trustful; conscientiousness, which means self discipline and duty; neuroticism, which is a tendency towards negative emotions like anger, anxiety, and depression; and openness, which is intellectual curiosity and creativity. Surgeons score significantly higher in openness, agreeableness, neuroticism, and conscientiousness than the general population and physicians. Women surgeons scored higher than men in extroversion and agreeableness, but whether this is a learned behavior in order to get on in their chosen profession or a selection bias by a male dominated profession is not really clear. Or maybe they just are nicer, I don't know. Uh, the the Sadly, the study also found that surgeons become more prone to neuroticism as they age, the inverse of the general population. Another study found that surgeons who maintain their empathy and are more introverted tend to have better outcomes. Surgery, despite being a deeply professionally satisfying occupation, remains it remains demanding, stressful, and unpredictable. The gap between success and failure can be frighteningly small. Surgeons experience tremendous highs and agonizing lows. It's important to experience one without the other. And some surgeons, by numbing their emotions, losing empathy, and feeling emotionally disconnected. This condition is called compassion fatigue and causes them to lose interest in things they used to enjoy, experience increased sadness and anger, and find it difficult to make decisions. Most surgeons experience anxiety and grief, which leads to increased rates of burnout, particularly among women surgeons. Under the mask of an overconfident and narcissistic surgeon, may grief and all the difficult to diagnose because of the mask of invulnerability they wear. The term second victim syndrome has been coined for the emotional trauma experienced by healthcare professionals after an adverse patient event, made worse by feeling that their own emotional trauma is illegitimate in comparison to the patient and the patient's relative. A recent study in the United States showed that 58% of students experience burnout in their careers, compared to 28% of working individuals in the general population and other occupations. A major contributor is a poor work-life balance, a consequence of positive surgical personality traits like passion, drive, and the pursuit of excellence, morphing into negative traits of poor delegation, poor prioritization, micromanagement, and perfectionism. Burnout and stress leads to alcoholism in 15% of American surgeons, and in one study amongst for women surgeons, as high as 25%. Surgeons are less happy than the general population, scoring about 25% lower than the general population in happiness metrics. It's been determined that 48% of happiness is genetically determined, 40% is determined by specific isolated events like buying a new car or doing a new operation, and 12% is derived from family, community, and work environment. The hedonistic treadmill is a term used to determine how much happiness one derives from achieving something. For example, as a trainee or a junior surgeon, one might be thrilled doing their first hernia repair, but soon it becomes routine and mundane. The surgeon now craves for a Whipple's or a liver resection or a transplant. The treadmill keeps getting steeper and steeper, so you need to run harder and harder to keep up with your level of happiness. Another concept which we will all recognize is called flow happiness. This is happiness experienced by highly skilled people from working towards a complex challenge that meets the level of skill they have without overwhelming them. As I said, I think all surgeons identify with this feeling when dealing with complex cases and having to make difficult decisions, and especially if they experience a good outcome. My wife says she now identifies three phases of my personality. One, when I'm waiting for the next challenging case, do it crabby and cantankerous. Two, when I get such a case, then I'm high and happy. And three, if that patient develops a complication, then I'm sad and thoughtful and completely absorbed within myself. And then the cycle repeats again and again. Perhaps some of you identify with this. It does appear that the stereotypical surgical personality has dulled over time. You don't see Lancelot Sprats in the operating theater anymore. We have turned into physicians who can operate in the true sense of the phrase. Uh, However, the inevitable demands of the profession can change us and make us prone to developing negative traits, and in some cases lead to burnout, compassion fatigue, anxiety, depression, or alcoholism. Modern surgeons need to be empathetic to their patients and kind to themselves. They must create an environment in which team members are not afraid to speak up or offer an opinion, factors that are vital to patient safety. In today's world, surgeons need to be confident, not arrogant, passionate but not micromanagers, leaders but not dictators, and have the ability to remain calm even in moments of life-threatening catastrophe while taking charge and successfully overcoming the challenge at hand. I don't know how we tread this fine line, but I think family, friends, and mentors help to show the way if we permit them. An article in the American Journal of Surgery in 2017 advised surgeons to protect and mature important relationships, debrief with trusted friends and family after stressful events, and seek professional help for symptoms of depression and anxiety. Surgeons in training at some centers in the US are provided enhanced stress resilience training. ESRT involves, among many other things, relaxation techniques, mindfulness techniques, and cognitive reframing. The latter involves identifying a negative emotion and modifying the perspective with which one views the thought behind that emotion in order to reframe it in a more positive way. Debriefing after particularly stressful events like the death of a child or an on-table death can be very useful if done properly. So has the profession we love changed us for the worse? The purpose of this talk is to make us take a good look at ourselves. What steps can we take to correct ourselves and rededicate ourselves to our life's purpose? Maybe it's time to reflect on how we can help the next generation of surgeons remain compassionate, nurture and enjoy relationships with family and friends, and maintain a work environment that promotes professional growth for team members and optimizes patient safety. Thank you very much.
Thank you. Thank you, Dr. Sanjay, for an excellent talk and making the effort to plan it this way and to present it this way. I just have two queries, if I may ask you, before we open it for the rest of the participants to chime in with their views and their questions. One is, do you really think there's any aspect of your personality which you would like to change and which would have made you a better surgeon? In the sense, I sometimes differ when people say you have to change this aspect of your personality, you have to change that aspect of your personality. I think it is what we are which make us the surgeons that we eventually become. So I personally, I'm not sure if you can change those and still become what you have become. I would be happy to be corrected, but that would be one question which I would like to ask.
I don't really know the answer to that. Clearly, you become what you become based on what you are, and your circumstances and the decisions you make and so on. But I do think there are, like, for example, I have quite a nasty temper, in the sense that I don't lose it often, although I might be grumbling within myself, but I don't lose it often. But I lose it maybe a couple of times a year. And when I lose it, I usually say things I regret. And I have to go and apologize to somebody or the other for having lost my temper and behaved badly. Uh, it's sometimes it's in the operating theater, but not necessarily. And especially in the operating theater, I think it's losing your temper is a really, really bad thing. Whatever anybody else may have done or said or not done, uh, all you're doing is that you're actually weakening the team rather than strengthening it at that point in time. If you're in trouble or you're having difficulty and you start yelling and shouting, it's just awful. I mean, the people around you are then much, less effective than they would normally be. So I think that is one aspect of my personality. I do it all, more often than I like, but less often than I have seen at least some of my teachers and all that in the past. Like, we used to have very sort of these celebrated surgeons who would be throwing instruments and sending people out of the operating theater and all this kind of stuff. I don't do that, thankfully, but I do sometimes quite sharp, and I always regret it and apologize. But that is something I would wish was not there in my personality. And the problem is I'm 63 and I still haven't been able to get rid of it. I don't think it's ever going to go away. So, so
So
yeah.
point very well taken, Dr. Sanjay. But again, I would like to add that the very fact that you go back and you apologize, I think
Ah,
that increases the bonding between the surgical team members. I don't think a surgical environment should be construed as an environment which is perfect and everybody's on their best behaviors. I think what
mm,
everybody needs to understand is that you're working towards a goal. But if
yeah,
at the end of it, whatever may have happened on table, I'm not supporting that you should be losing your temper again. I'm not supporting that at all. But what I'm trying to say is that even if you do lose your temper, so long as you go back and apologize, I think that connect is makes your relationship with whoever it is that you may have lost your temper with much stronger.
yeah,
So
yeah,
again, as I said when I started this, I am really not sure you need to change too much about yourself, but maybe just an awareness that
yeah,
I tend to go wrong, but then I also make up for it. I may put in that effort to make up for it, just like as I do everything else in my surgical career.
yeah,
Uh,
yeah, yeah,
right, sir. And one more point from my side before we ask Gayatri. Gayatri has raised her hand. Do you
yeah.
think the younger generations now, the ones who are coming up or who want to take up surgery now,
Mm.
especially super specialty fields, uh, do they require a different set of traits, or it's just a general thing? I mean, you're either a surgeon material or you're not, and it doesn't change through the generations.
No, personally, I feel anybody can be a surgeon. Like, I don't think it requires anything too dramatic. It just requires the will. I mean, my philosophy in life is that, I don't think there is a single profession in the world which can only be done by, I won't say a single, but, like, if you take, I mean, there are millions of other people doing the job you're doing. So I don't see any reason. That's been my philosophy. If you want to learn how to do transplant or you want to learn how to, I mean, what's the big deal? There are millions of people doing it. And if they could do it, then you can jolly well do it. But it requires an effort from you, and you have to go about uh, doing, learning how to do it and make that effort, which can sometimes be difficult. And now, because of my Alzheimer's, I have forgotten the question you asked. What did you start with?
That's okay. So you've answered it very well. You've answered it very well. So, Gomti, hi. Gomti, can you unmute yourself,
Yes,
please?
yes. Hi,
Hi.
Supriya.
Hi.
Hi,
Please,
Dr.
please.
Sanjay. So good to hear you
Hi,
and see you
Gomti.
for a long time.
Yeah, you
Hi.
too. Yeah,
It
you
was
too.
fantastic
Thanks.
listening to you talk and put out
Can you
so
start your
many.
video, please?
Yeah, sure. Can you see me now? I'm trying to, but I'm not unable to start the video.
You should be able to now, ma'am. Yeah.
Yeah, visible.
Okay. I think somewhere you can see me. Okay. So, so I'm just going to, the other side of what Supriya asked now. As surgeon, I mean, the current generation is different in many, many ways. When I say current, I'm talking about the ones who are probably entering into medical college now. They are way different in all specialties they do, not just medicine. So the approach is changing as to how we have to adapt our fields to make it interesting for them. Now, from this perspective, as seniors in the field, what would our way of approaching them be? To keep them interested in what we are doing or in the profession itself.
In my opinion, the most important aspect is to keep them challenged. Is to keep challenging them with not just intellectually, but also challenging them intellectually and allowing them to grow in small ways. I think in many places, and especially in many of the corporate hospitals, I would say that people tend to get stuck. Somebody comes and join. I mean, meaning what I mean is that they join at a particular level, and it's not easy for them to progress from there. They're basically being used as cannon fodder in a sense to assist at surgery and do very mundane tasks, and there isn't the effort made to teach or discuss topics or bond even in. But I think, like, as long as you keep them both intellectually challenged as well as growing professionally in the way in which, even small steps in the operation uh, or presenting something or writing something, I think that is what will, in my opinion at least, keep them as part, feeling
Yeah.
part of the team.
Yeah. I mean, if I may
That's
add in
really.
absolutely what you said, and in addition, I think they are extremely bright. I think the next generation is
Yeah.
bright, but they're different from us. They're very different. So I think we should not still carry this old saying like, "Oh, I used to work 48 hours. I used to do 72 hours." Doesn't mean a thing to them. They would say probably you were inefficient. So we don't want to get there with them. We just have to, get into a little bit of a different mindset and take them along. Thanks, Sanjay. It was wonderful
And we
listening to
got to
you.
remember, Gomati, that our seniors said the same thing about us. That in
Yes.
our day it was so much more difficult. You guys have it easy, and now it's different. So the whole thing is very, very different. And I think, but the one thing I think which hasn't changed much is that for a surgeon or a trainee or who is passionate and trying really hard to do the right thing, the emotional challenges have not changed all that much. Although the previous generation may have been doing simpler sort of cases, but at that time it felt very difficult for them. I remember when I was a postgraduate, I mean, to do an AP resection, I had to call my boss after I'd positioned the patient, and he would stand in one corner and say, "Oh, I think you got to raise it by 5 degrees this way and 10 degrees that way." And the operation would go on for like hours. And now, nobody even bothers. AP resection, some, operation theater assistant comes and positions the patient. You don't even come and check. The operation's over in an hour and a half. Nobody cares. But you moved on to more complex operations and more complex things, but the emotional challenges when you lose patients or you have complications, or you do something stupid in the operating theater, or you feel that you didn't pick up on something, a diagnosis quick enough. I think those emotional challenges remain, and so these other problems of burnout and so on do hit you. Many people, I mean, I'm not saying everyone, but do affect you, particularly mid-career. It's not uncommon.
Um, May I say something about this
Yes,
discussion?
yes, Sumana, please.
Okay,
Please,
so
please say.
see, I do believe that the younger generation is way brilliant, way exposed to a lot of knowledge when it comes to theoretical knowledge, and I feel that what is lacking is commitment. Um, they don't what I see in them is that, see, probably again that is a failure of what we have done over the years. Probably we didn't tell them that okay, this is the right way to do it, or just because nowadays, because the training institutes are filled with so many people, probably they have not got individual attention. They were just made to do things which are like do the scut work and not really get involved with patients, that you do something and then you're answerable to patients, go do counselings. This part of the thing which I see is lacking. They are much more exposed to technology. All that is there, but I find one thing which is missing is that they are they are like, they have an attitude like I don't care. I don't know, I may be wrong. But I feel that again, that's a system failure. That is what we have not done, not taught them. And um maybe like things like, Arey, I want to do it. I mean, that competition is so much that I just want to learn this. I don't care what happens with the patient. That attitude I see a lot. I'm sorry if somebody gets hurt, but that's what I have seen. Maybe that is just my experience. And again, to getting angry, yes, I think we surgeons have this habit of being perfectionist. We are not getting angry if, I think we get angry at ourselves also if we make a mistake. The same thing we do with others, when especially when you've been teaching them every word that you're doing. I also get angry when I'm when I'm in the OT. But I get angry, like, say, because I tell them every step. I tell them this is how you should do. This is the nurses. I tell the juniors, like, when they don't do it, that is when I get angry. Like you, after that I go and apologize to them also. I say I'm sorry that I got angry. But I think it's intrinsic. I think to do the right thing, probably it doesn't really hold good in the present world. We are stuck up somewhere that this is the right way to do it. This is the right thing to do it. And for us, I think for most of us, the patient is the priority. That I don't see in the youngsters. I'm really sorry to say, I don't see that in the youngsters.
So, Dr. Sanjay, shall we ask one of the younger fellows to
Yeah,
come in?
I was just thinking that I see Gayatri there trying to.
Before we move on, I had a request. Could you repeat the personality that you describe for male and female surgeons for some of the people who joined a little late? I found that very interesting.
The first bit.
Yes, sir.
The first. Okay, so just remember that this has been written. Uh, so this I quoted from an article. So this is the typical male surgeon. Is a testosterone induced. They have a testosterone induced swagger, confident, brash, charismatic, and commanding to the point of arrogance. He is volatile, even bullying and abusive. Cuts first, asks questions later, because to cut is to cure, and the best cure is cold, hard steel. Sometimes wrong, but never in doubt. Good with his hands, but has no time to explain. compassion and communication are processes usually followed around the ward. Now, this is stuff I've added on, but usually followed around the ward by adoring, almost lustful medical students and nurses. But he is also decisive, well organized, and hardworking. And for the woman surgeon, they are cold, impersonal, moody, a micromanaging shrew, a castrating harpy. Actually, the full quote is a castrating harpy bitch. I left bitch out the first time. In fact, in the original article, bitch is repeated 3 times, bitch, bitch, bitch. And the way that author introduces it is like it's written by a woman, and she says that compared to the male description of the surgeon, the women, I mean, he sounds like a teddy bear compared to the woman surgeon. And when she uses this word, but yeah, I mean, people are, and the other thing is that, I mean, which I did bring out but didn't highlight, but is that burnout is actually worse, is higher in women than in men. And at least according to one article, which was talking about alcoholism in surgeons, women in the US had a much higher rate of alcoholism than men, which, so, I think the
Okay.
combination of family and work really puts huge amounts of pressure on women, which we all know, I guess. Yeah.
This looks like a complete Grey's Anatomy surgeon.
Yeah.
So again, can I ask some more of the youngsters to come in, please? We really want to hear from you what you all think about this. Nalini, if you're around, would you want to let us know what you think the current crop who is going to take up surgery, in your opinion, are there any specific traits they need to have? Or as Dr. Sanjay pointed out, if you have the intention, just about anybody can become a surgeon. Are you around, Nalini?
Yes, ma'am. Actually, what sir has described, I can correlate well. We were seeing my entire career. I have seen what sir has already told. I have seen surgeons from very temper to very calm and quiet surgeons. And as a young surgeon, I was thinking, how should I go about? Like, should I be like a surgeon who is shouting, throwing instruments, shouting at the colleagues and nurses, anesthetic sides, everything. But what I could figure out since last 10, 15 years is that the surgeon who is very calm and quiet has done better in terms of surgical outcomes. What we feel in shouting or these things, we spend more time, we do more blood loss, and we do some harm to the patient, which is not recoverable. And we have learned that in surgery, the best outcome is given in the OT. If you have done a complication, then you cannot manage it properly in the post-operative period. The best thing is to prevent a complication is to prevent during surgery. And I think that what sir has already told, we should look into ourselves, how we can be a better surgeon. It is not about just following one senior surgeon's path. So what sir has told already, we have felt in our life. And for the young surgeons who are aiming to become a good surgeon, what I feel that as ma'am has already told before me, that everyone wants to be a big surgeon in a quick time. They want to do all the procedures. They think that it is the duty of the seniors to train them as quickly as possible. They should be given that much opportunity. So a little bit of a problem in terms of attitude is there, but as a surgeon grows, when he takes responsibility, suppose he goes out of the institution or any setup from where they're being trained, they gradually tend to learn these things. When everything comes to their head and they have to take responsibility, and gradually they feel the need to change their attitude and also how they deal with the patients, relatives, and it's a actually long, it's a learning thing, and it takes a lifetime. Like sir has told us, if sir is already 60 plus, and he is also telling his limitations and all. So everybody has got limitations, youngsters to yeah, us like us also. So it's a very good thing to uh, learn from seniors, and also it is the attitude to change. The courage to change is a very important thing. So I think we should take up this idea to look into us, our means abilities, limitations, and how we can be a better surgeon.
Yeah. Thank you, Nalini. So just to give context, I think Nalini is 3 years post MCH, Nalini?
Yes, ma'am.
Yeah, so Nalini is 3 years post MCH. I can't see the other participants. So if someone who is less than that would want to come up and say something, we'll be happy to hear.
I'll just go through the list to see who's younger.
Yeah,
In the
because I
meanwhile, I
can't see
think
the list. Yeah.
Dr.
I,
Ragini is here,
I
who's
sent
I
a
think
link. I sent a link to my son, who's just finishing a mountaineering course in Arunachal, but I think he slept off already because he's fresh. Immediately finished his MS, and I think he would have given her. He was too scared to open his mouth till now, so it would have been a good time to actually give.
So Dr. Ragini is here, who's basically not extremely senior and not extremely junior, but somewhere in the middle. So I think she's also somebody we would like to hear from what she feels.
Yeah,
Hey, hi,
hi.
Ragini.
Very nice talk, sir. Really was interested in knowing what one means when we talk about a surgical personality. All my life, actually, I have always felt individuals have personalities and not professions. And there are some traits, however, which are important for success. And these are important for success, irrespective of whether you take dermatology or you take HPB surgery, EGI surgery, or transplant. So you have to work hard. You have to be determined, and you have to have some grit to carry on. So this is what I believe. The rest of it is how soon you lose your temper, how calm you're able to be, how well you're open to suggestions are individual personality traits. And personality traits that make you more of a team person are always good for you and the team in the long run. That is how I look at it. And I also feel that personally, if things are not going as per the plan in the theater, keeping a calm and a cool mind allows you to assess and take a logical decision, and makes it easier for you to do things than losing your temper, panicking, shouting, making other people lose their marbles. Nobody is in a state of mind to understand or to give a logical suggestion, also, or people are too scared to approach you at that point in time. So that's how I feel about it, that the calmer the person in a state of when things are not good. So you're all calm when we are doing a simple surgery. But it's when things are not going as per the plan, that's when your true personality emerges. And I don't think most of us can do anything about it at that point in time.
Yeah, Ragini, that's very, very well put. And
That comes
that's
with
another thing.
experience. That eventually comes
Yes.
with experience.
And that's another thing I think we tend to miss. As surgeons, all of us would have to be very good team players.
Yeah.
I think we would be the first ones to acknowledge simple surgeries, we're not even talking about them. Difficult surgeries, it is not just about the surgery. It's about your anesthetist, it is about your assistant, it is about your nurse on the table, it is about the resident who looks after the patient in the post-operative period and is the first person to pick up any deviation from the normal expected course, which is when you as a leader will come in to say what is to be done and what not to be done. But the first pickup is by your team member, not by you necessarily. So as surgeons, especially when you reach slightly senior positions, you realize you have to be or at least you have to learn to be a good team player.
Yeah.
I think, see, I think first everybody should understand that we are doctors before we became surgeons. So if our intention in our mind should be to be a good doctor, na, I think eventually all this learning great surgical skills, I will do the best surgery, most complicated surgery, everything will fall in place. So the first thing that we should think is why we became doctors, and then when we realize that, so then the person who is there on the table or just in the OPD anywhere, he has come to us with full faith, and our intention should be that person doing the best you can do for that person. If you start thinking this daily, I'm sure the skill set and everything will come eventually.
I think actually that going back to that, why I am doing the job I'm doing
Yes,
helps
sir.
you not only just in the operating theater, but anytime you're having a difficult time in your profession, somebody is not treating you well in your job, you're not happy, you're finding it boring, you're finding it too tiring, you're getting going back to the basics and saying, okay, why did I join this? Why did I had no regrets taking up this profession, and I was looking forward to it. Going back to those basics helps quite a lot to keep you, even whether it's in the operation theater, of course, but even otherwise, when you're having a tough time, uh, it sort of keeps you on an even
Absolutely, sir.
keel.
Absolutely. Yeah.
Hey, Manpreet, do we have anybody else from the younger people who are?
I think not many people have joined today.
So actually, there were a couple of people, and I messaged one or two if they would like to speak, and they just left that meeting. So
Okay, in the
Kush
meantime, others.
is
Yeah,
here,
Kush.
and Kush, I think, is also one of the somebody who's relatively recently finished MCH. So
Yeah, Kush is, yes, Kush, please ask your question. You put it up on the chat, but please ask
yes.
it yourself.
Yes, sir. Good evening, sir. Thank you for a lovely talk. It's always a pleasure to listen to you. My question was that during our surgical training period, we always, tend to find one mentor whom you idolize. And, during the initial learning years, you try to, kind of, adopt qualities from that person, and, you look up to that person.
Yeah.
So, in your career, has there been any one person from whom you adopted such qualities, and what has been your experience that throughout your journey?
Yeah, I mean, there's no doubt that's a very familiar refrain. I mean, I'm sure everybody has been through that where you are, you
Have a
idolize.
hero. Yeah.
Yeah, you have a sort of surgical hero. But only thing that I would say is that uh, I think that it's not a great idea to have one big hero, because it's too much for that person to live up to, in my opinion. And there are many people who will at different times in your career will give you different things which you need. That first hero may not be the hero you need when you're in your 40s, say, and so don't sort of focus on just one person. You'll get positive inputs. Try and get positive inputs from as many people as possible. I mean, it's a little bit like, I don't know how you guys are with your parents, but like, when you're young, you think they're absolutely wonderful. And then at least I went through a phase when I thought they were absolutely ghastly. And then you sort of mature after a little while and you say, the poor things were trying their best in whatever they may or may not have done. And it's very similar with these heroes. I mean, if you're mature enough to be able to accept that some of these heroes are going to have a lot of negative, uh, may have, or like any human being, are going to have some negative personality traits which may surprise you suddenly. That should not take away from the fact that they gave you so much at a time when you needed that particular thing from them. So that's all I would say about idols. I don't have a single hero in my life who I say, oh my gosh, but this is just, I want to be a carbon copy of so and so, so and so. I want to be me, and me constitutes little bits from lots of different people, who may be senior, who may be junior. There may be things that have impressed you about somebody that a junior person could, and you sort of wish, uh, I mean, I wish I was like that when I was a few years ago, but maybe, I mean, I'm sure that you'd be a role model for many others in the profession, both senior and junior to you. So, get what you can from anybody, get all the help you can get.
I agree, sir.
Yeah.
Sorry, ma'am.
No, that's okay. So, Dr. Sanjay, if I could push you a little bit and ask you if you could just spell it out for us, one trait in you which you think you have been blessed with.
Which I've been blessed with.
Which has helped you, let's say, soar above your other contemporaries in the surgical field?
Apart from you're looking like other people.
No. Are you able to hear me?
Yeah, we are able to hear you, sir. We're waiting to hear you.
No, that's all. I don't know what else. I mean, everything else is just, you just keep going.
We didn't hear what you said.
Oh, sorry. I said confidence and perseverance.
Okay. There's one more thing I'll add about Dr. Sanjay. His juniors love him. They say that whatever they've learned is from him. I know two of his younger colleagues who are my good friends, and this great things I've heard about Dr. Sanjay.
Thank you very much, Sumana.
And so if I had to ask you one trait which you think, you mentioned about your losing a temper, but that is, I think, everybody would agree with that. But if you had to be honestly say, what would be the one thing that you wish you had, which you have seen in others, but you wish you had, and which you think would have made you a better surgeon?
I don't know. Maybe because this confidence that I have, I can't think of a negative trait.
I just wanted you to say it. So that is
No. That question is not right, Supriya. You should not have said that. Nah? You framed the question nicely in the beginning. No surgeon. I mean, obviously, everybody is doing their best, isn't it? Sir, you said better than someone else.
What is that?
What I was trying to drive at is that as surgeons, although someone might accuse us of being narcissistic, people might, tend to believe that we are super confident, we are arrogant, and all of that. But again, as the point which I had raised at the start of this, I think it's all okay. It all goes into making us what we are, and it is fine. And this, as Ragini herself was saying, this whole laying too much of stress on what are the personality traits of a surgeon, and this is it's okay. These are okay, nice topics for a chat. But I think at the end of it, it's all individual driven. You can go, you can be what you want to be, so long as you're able to put in the work and the dedication that is required to reach there.
Yeah.
But at the same time, it doesn't escape your notice that when you reach Dr. Sanjay's level, there is a quiet confidence which comes from having done it all. And the path, I'm sure, till there has been very arduous and backbreaking, and has demanded a lot. But I think, Dr. Sanjay, you have, to all of us at least, you have been a role model of how to be such an affable personality. And of course, that you're an excellent surgeon, your juniors think so highly of you is all added. But for all of us who have not seen you as a surgeon, as is in the OR directly, the affable personality that you are is like so contrary to what one thinks of as a super successful surgeon. Again, just goes to show as such a such a good poster boy for the surgical fraternity.
Yeah, I second it. I totally second it.
Okay, thank you.
Yeah,
I think, I think as we grow, if we have time, as I think as a more experience comes, the humility becomes more and more prominent.
Yeah.
The more the ego tends to go away. I think ultimately for a surgeon, no matter what, ultimately that narcissistic behavior, go getter, doing this, all that will go away when you really understand that you are not the one who is doing it.
Yeah. Divya has raised her hand, and Divya is much junior to me. So I would really love it if Divya can pose a question, please. Divya, are you around?
Yes, ma'am. Yes, ma'am.
Yeah, please go ahead.
Good evening, everyone. Very nice talk, sir. Uh, as a surgical trainee, uh, I I used to think, do I really need to fit into some traditional surgical personality to succeed, or is it okay to crave out my own identity within surgery? But after working for one and a half year independently, I find out that no, I don't have to follow some personality, but it is your hard work or your focus that is all is required. Um, oth- uh, Other than that, I just wanted to ask one question, ma'am. Sometimes I get emotionally affected by my patients or patient's outcome. Is that a weakness in the surgical world, or your emotional sensitivity can coexist with this profession?
I think that that's a great question, and I think that it's important that your emotional sensitivity coexists. But I have to say, it does make things difficult for you from time to time when you do this, and that is the challenge, because keeping that emotional connectivity makes you a better doctor and a better surgeon and a better person overall. But it also takes its toll on both you as well as on your family. At least I would say, as a male surgeon, my wife suffers through a lot of the stuff that I suffer through, or I have suffered through. It is important that you deal with these emotions, because as I said, sometimes, and I can say this has happened to me for sure, where I just try to dumb down the emotion. I don't want to feel it, and it does extend into other parts of my life, so that I don't uh, sort of feel the degree of both happiness and sadness that I might feel from events even outside of my surgical life. So I think this is very difficult, and that is why uh, I think, although we often think of these things, and this may be again, I don't know whether it's Indianness or whether it is surgical personality, but we just think these things are a whole lot of bull. This we can you can handle it, but it's often not easy to handle, and uh, you need to. I mean, I was told, although this never happened to me, like when I was starting to do whipples in Vellore, and I had this great feeling that we've got the best done hospital here. We've got all the facilities, and there is no reason why I just couldn't understand. I couldn't understand why I couldn't understand why is it that Mass General has a mortality of 2% and I'm having a mortality which is somewhere around 5, 6%. Why am I not able to get it down? This used to really bother me. And it's just that uh, I was told that when these deaths occurred, and I was agonizing over what I could have done differently, I was told that you should go through debriefing. Now, when I looked up debriefing now, it seems to be a lot more, there are a lot of pros and cons to it. So I don't know whether it's the right thing. But I do think that having, uh, that's why I said I don't really know the way to go through it. But I think having a very supportive spouse, having, if you're lucky enough to have that, having a mentor and good friends who are also supportive of you is really important for you to occasionally be able to vent these feelings, because I think they can be, if they fester, and like with everything, there is a certain amount that is good, and when you go beyond that, it becomes pathological, or it starts damaging you. So you have to be a little wary of that. And the time when you will feel it the most is when you start working out on your own, when you're in an institute and you've got a lot of your training and you've got a lot of support around you, it's a little easier. But when you're out on your own, then things can become quite difficult to handle sometimes. At least that's what I found. Um,
It's a spot on, sir, spot on. And sometimes it is nice to hear it from a senior, let me put it, senior male surgeons, that this emotional feelings take a toll on you as well. So many of us grapple with this thought: are we as females more emotional about our patients, more than what is normally expected and accepted? So it's nice to hear. So to hear that it can affect anybody, and you need to find ways and means to deal with it. One is, as you said, if you could have a partner or a spouse, and I think having a surgeon buddy is also a good thing. I mean, you're extremely lucky if you can find a surgeon buddy, uh, and talk it over with that person, explain your thought processes, and let out whatever you need to let out with that person. Dr. Puneet Dhar, sir, are you around, sir? Dr. Puneet,
Yeah.
sir?
Yeah.
Yes, sir, please.
No, I think I love the talk. About the youngsters, we keep sort of trying to berate them, but what Kush said, that we mirror what we saw. So probably we must be being bad role models if the youngsters are turning out like that. So that's one thought I was having. As surgeons, I think what Sanjay said is absolutely true. I don't think there's any difference between guys and ladies about responding. I think I've seen guys even more emotional, and some of the strongest guys whom you would think, the typical macho surgical type, are absolutely emotional at the time. And I think that's very important to have that, because if you don't have that, you're never going to have the empathy. We need that empathy. We need to continue having that connect with the patient. And I think over time it actually increases, at least in our generation, because I saw a lot of our older colleagues, old as in, much older colleagues, have a distance from the patient. But I feel myself getting closer at this as we age. So I think the younger generation do want a more balanced life, and I'm actually all for it, because I think we have what should I say, deified, apotheosed this surgical personality of somebody who has sacrificed his whole life. I'm not sure that's a good balance that you can convey to the patient as well. Sanjay is an absolutely all-round person in everything. That's why he's, what you said about his personality and all his affability and everything, his looks, similarity in looks to a lot of other people has all helped him. So no, I'm just kidding. I'm just kidding. A lot of people say that we look alike. That's why I'm just pulling his leg. So, so I don't think so, but a lot of people have told me that. So so I think a lot of those things are there, which we don't realize. So I think we need to not what should I say, make it trivialize this balance in the personality, because like Kush asked in the chat box whether we should have hobbies and all that. And having gone through burnouts multiple times, I think what really saved me and got me back on track, and back on track in a big way. In Faridabad, I've been, tomorrow, I think the first lot of DNBs joined. So for the first 3 years, I've acted as a pure resident, doing putties, taking out stitches, mobilizing the patient. And I don't think I would have done that if I hadn't burnt out and reinvented myself. So I think it's very, very important to have all those hobbies and all that. But like somebody said about the surgical buddy, I think that's one crucial thing. It doesn't have to be a peer, but I think it's mandatory. It could be somebody on the phone. I have a guy from, Hyderabad and several people from Bombay calling me up and discussing about things. They're not actually not asking questions that they have a problem. They just need validation that what they've done is correct. So I was very lucky, in Supriya knows, in Cochin I had Sudhi, in AIMS, Rishikesh I had Sumit Sanyal and the others. In here I have Salim. So where you are completely honest to the core, you're not hiding anything about from and that person knows you and doesn't judge you. So I think that's been a very useful saving grace. So if you can have that, if it's in the same department, it helps. And the same person should be able to criticize you also, but not at that moment when you're down. So I think all those are important, and I think all those things shape our personality. I don't agree with Sanjay that the instrument throwing variety is not there. It's still there. I saw it last week in our general surgery department. I found the entire, the residents crying, and I realized that somebody had been, throwing a fit and a tantrum. I think it's a lack of maturity rather than arrogance. In a way, it's an inferiority issue. It's sometimes for me when I've been angry, it's I think a frustration and impotence with the situation of not really sure of how to deal with it. So I think all those are there which we don't realize, we don't psychoanalyze. And I think one good thing that we should learn from the younger generation is they actually seek help, professional help. We refuse to seek that. I think that's one thing which is wrong with that. I know how to handle things and all that. So I think we need to change that way. And I try to emulate the younger generation much more. So I know it looks like I don't care, but I think that's a bit of it is our fault also. It's how much we allow them to, have that. I think I've spoken too much. Yeah, we should have somebody else.
Please, you can continue.
You certainly enhanced the proceedings. Sharvari, are you around? Sharvari is around.
Sharvari
Actually, I can't see the participants, so I can't
Dr.
actually.
Vibha is here, and she's I think
Sharvari was there sometime back. Yeah.
Yeah.
She left. She's not that.
Okay.
But Dr. Vibha is here.
Yeah, Vibha, please. Dr. Vibha, please.
Ma'am, we can't hear you. Can you?
Yeah, hi everyone. I enjoyed the talk, Dr. Sanjay, and I think most of us, we echo the thoughts which you shared. I missed the early part. Actually, I've just relocated, so a lot of hotspots is happening at home. So I forgot about the thing. But yes, I think I can only reflect as a surgeon. I have metamorphosed over my years of training, and as a junior consultant or a consultant, and now I would say I am senior. I am heading a department, and I have learned a lot during these years, like how you expect a senior to behave with you and how you expect your juniors to reciprocate. I think I have been in shoes where I'm a junior and I'm working with a senior. I'm a senior working with a junior, and I'm learning from them, and I'm assisting them and they are learning from me. So, and as about temper in OT, I used to be very aggressive as a trainee. I was with Dr. Nandi, I was emulating Dr. Nandi. So people will be scared when I am operating because I think that I have an umbrella of Dr. Nandi, so I can do whatever. But yes, I have learned that you have to be in your own cool self so that your own team members also, they can behave well with you. So when things are not going the way you want them to go, you actually have to stall, probably call for help and take situation under control. So I don't mind taking help from my juniors. taking suggestions from my people who are standing across the table. So I have been, I would say, lucky, unlucky, whatever you say. I have learned a lot during my last 30 years, and I'm yet to learn more. But one thing I will say, I will never retire, and I will emulate what Dr. Nandi has been doing, because the day I retire, I feel surgery is a therapy for me. The day you operate, you feel so good. You don't get tired, even if you are operating the whole day without food. So what I don't like in the youngsters, please don't mind what I'm saying, that they get tired. They need break. But as a surgeon, even when I was a trainee, maybe whatever the situation was, if you love the job, what you are doing, you don't get tired. So I just differ in that. But yes, I agree with Gomati and others that youngsters, they are much more brighter. They have a wider view how they think than what we were. And I think it's because the generation gap which is there, they have more avenues of learning than what we had to really go to the center to learn. Now everything is available online, offline. We don't have to read textbooks. We used to read textbooks. In my relocation, I have had hard time getting rid of my books, you know, which I have not opened for so many years. I feel everything is available now. And that's it, I would say.
Hey, thanks, Dr. Weber. Coming from you, one of the most senior surgeons in the group.
I'm still opening patties, admitting patients, discharging them, and I go to OPD, I go to ward, write my notes. So I'm junior, senior, both.
That is why you're so inspirational.
Just one point about, the surgery being the be all end all of your life. There are some downsides to it. I don't know, Supriya would remember.
Yeah, I'm sure it is. It is there. I'm trying to find out. So just one more thing, what I wanted to add. I'm trying to make more friends, and Sumana knows that I'm in a course of management, that GMHE from IIM Mumbai, and I have made networks with very young people in different jobs. And I really like it. I'm very senior, but they are all junior people, and we have fun together. We have our last session in July end, and I feel I just come down to their level. So even if I am 56, I don't behave like 56. And I won't like to behave like 56. I hope I remain young.
56 is the new 26.
Yeah, correct.
No, so what I meant was, I don't know if Supriya would remember, we had one neurosurgeon called George P. Abraham, who recently committed suicide because he realized he thought his skills were failing. So it shouldn't be that point of being obsessed about surgery. Being obsessed as a passion is absolutely, I mean, it's a driving, it's the thing which drives you. So that is worthwhile, but it should not be that you cannot do without it. That is, because that can be.
Agree. Yeah.
So Gayatri, I think, is finishing her liver transplant fellowship, and she's also been a faculty at one point. Let's hear from her also what her views are on being both sides of the spectrum.
So I just have a few insights, just experiences that came into mind when I heard this talk. So I remember I was during MS, during my peripheral rotation in urology. So I won't name who, but he was I think junior consultant at that time. I was scrubbing with him for some case that he let me do. And I was very timidly asking for something, and the instrument wasn't working. And he told me, Gayatri, learn to make a fuss. Surgeons have to make a fuss. Otherwise, you won't get things done. So, and I've reflected on that many times subsequently in my, because on one hand, yes, you need things a certain way. You shouldn't compromise on, quality. But on the other hand, you may be in a resource constrained setting. You may be, you have to look at economics. You can't use every suture you want. You might have to adjust a little bit. So is adjusting wrong? Is it compromising on perfection, on what a good surgeon should aim for? I've wrestled with that a couple of times. To list another example, wherever I worked, I was thought to be one of the more easy surgeons to operate with. So the head staff nurse would always send the interns or the trainee nurses to assist me because I wouldn't yell at them. So she was like, "Madam, I can't send them with so and so because they'll shout. They're not patient. So they'll send them with me." So, sometimes I don't know whether to be offended or whether to take it as a compliment. I mean, okay, is it because it's a good thing or a bad thing? Is it bad that I'm accommodating and not making a fuss? Should I also put my foot down and, yell and scream? Then I'll get the best nurse to assist me. So I've thought of both ways. And is it a bad personality trait?
No,
Or is it a
Gayatri,
good
I think
personality
you
trait?
should be
I
proud of
mean,
yourself.
yeah, no. So these are things that I thought about because I dealt with it.
Wherever I go, that has happened with me. That you get the junior most nurse. Even for a transplant, you'll find a nurse who has just finished nursing, and she'll come and stand no matter what. So initially, I used to get very angry that they don't send me the senior nurses. But now I have made it like I can operate in Timbuktu also. With then when I started telling this loudly to everybody, now people are like, okay, we can also do away with a junior nurse. So you should feel happy that you can still do it, but it's always better to have somebody senior, especially when you're doing a case which is difficult.
So I think at the end of the day, we're dealing with stereotypes. And, whether it's what a stereotypical surgeon is like, or a stereotypic male surgeon is like, or a female surgeon, we're dealing with conditioned thoughts or notions in our head of what this type of person should be. And I think
Necessarily.
that's what we're trying to change, whether it's women or whether it's surgeons or, lone wolf versus team player. I think that's what we should realize, that there are many ways of doing it, not necessary that one is wrong or one is better. But I think we all agree that, as everyone has said, times have changed, viewpoints have changed, and you can't go around being that gung-ho, I do everything, I am the only one doing mentality that maybe we have seen in a lot of seniors as we've gone through our training. So I think that's essential, that we break the stereotype. I also think it's institutional. What I mean is, again, maybe I'm being stereotypical in a way, but wherever I went, pediatric surgeons, they're also surgeons, but I don't know, maybe different, but all the pediatric surgeons I know are very soft-spoken. They're very gentle. Maybe it comes with dealing with kids day in and day out, but that's also a personality trait which suits that specialty. So maybe they've had to evolve because they were also general surgeons at some time. So I think it's cultural, it's institutional. It's, again, you see other people, it's the patients you deal with. So all that also affects your personality and, how you approach things. And to end, I remember what Dr. Sitaram told me once. I was a senior PG in his unit, and there were some issues we had among some non-PG, non-academic SRs and interns, and some issue was there. And he told me, Gayatri, I forget the quotation that he told me, said some journal somewhere, they had a poll and they asked what were the 3 most important traits of a good surgeon. And he told me ability, availability, but most important is affability. I'll never forget this. He said, this is what makes a surgeon. So I think that holds true, not just for surgery, but in everything. But in my mind, that's what I try to live up to. I'll never forget that. So that's just my thoughts. Yeah.
So I have been somebody who does create a fuss, on the opposite spectrum at times. And I have a question for you, that how do you deal with the absolute junior nurses? Sometimes they will absolutely not know what to do, and you're in the middle of a bleed. What helps you manage that?
Yeah. So again, I think what Dr. Sumana also said, if you're in a situation that demands a certain level of assistance and expertise, yes, you stop and you make demands. I think that
Make a
you have
fuss
to,
that time.
that is crucial. You need to
You
know
have to make a
what
fuss.
situation
Otherwise,
demands
people.
what level of, and that is, there's no doubt. Again, you're not, ultimately you don't want to compromise on care. So if it's a certain difficult procedure or certain something like that, I am doing some procedure that requires a certain level of assistance, or I'm in a particularly crucial area, like you said, then I think that's part of it as well. You need to know what to ask for. So being too much of a doormat is not good.
Yeah,
Knowing
don't.
when to ask for what is extremely important, I think, yes. Generally, for the small things, I don't really make a fuss. There's no point. They're also learning. We were also there at some point, making fuss, making mistakes, giving the wrong suture, giving the wrong instrument. I mean, asking, I think that requires a little bit of patience, but it's okay. But for the critical, if there's an issue, then I don't think there's anything you are expected to escalate. I think at that point, adjusting and you're doing an injustice to the patient. That's how I think.
Yeah, I like Gayatri's use of the term expected to escalate. I think all of us need to sense that moment, because whatever you might say about the negative traits of being a surgeon, but still I honestly believe that it is that persona which sometimes forces a result and forces an outcome on the table and for a patient.
Yeah.
And that is, it's very nebulous. It is probably will be very difficult for anyone to exactly pinpoint, but I think that is what marks a surgeon out from the rest of the medical practitioners. That ability to sense, to change personality, and to draw out from others as well skills and actions and attitude, which all combine to make a difference in a hopeless situation. I don't know if I have been able to convey what I want to say, but somewhere I think it is there, and each one of us has it. I mean, if you're a leader of a team, you have to have it, otherwise it doesn't work out.
I'll make it simpler. Whatever you said, Supriya. It's just you have to do what you have to do the right thing at that point of time. Whether you are doing it nicely or you are raising your voice, because if the rest of the team should understand that your intention is not about trying to hurt anybody there. The intention is to get everybody there to look for the patient. Then the nurses also will understand. They will not feel bad. They will not cry. The juniors will not feel bad. They'll only say, "It's okay, madam. We understand why you did it." I know the nurses coming and telling me outside, if I say, "I'm sorry, I had to shout," they'll say, "No, madam, we understand why you're doing it." So we have to make everybody, as a leader, like at that point of time, you're the only one there. And you have to make everybody feel that, okay, we are all responsible for this patient.
I think this is what makes the situation on table a bit light. That even if whatever you are shouting at, it's not actually shouting. You are emphasizing something which is lacking. And
Exactly.
that is all for the patient. Supposing some instrument is not handed over when you really need it, or the suture is not available what you need, you've been telling them 10 times, and when you raise your voice, it is only because it is not there despite telling them. And later on,
it's like an alarm.
I always tell them after surgery that on table what I do is only because I am upset because things are not going the way it should, and it is for the patient's sake. It is nothing personal. So later on, I think you can gel with them, you can be friendly, but on table you have to have some professional approach. Someone might look at it as you are aggressive and shouting. I don't throw instruments and all, but I get firm when things are not available. If I want something, that has to come. So, and I think you tell that before the step is coming in. Sometimes something goes wrong, you're not preempting that. That is wrong. So, something which you tell them that, okay, I need this, then the scissor. In fact, as a surgeon, I have started telling them like a step of surgery, because you have people assisting whom you don't know, and they may be very junior, like Gayatri told. I used to be an aggressive surgeon in Gangaram. When I went to Max, The junior most person who doesn't even know what to do was given to me. I had to work with them. So you have to learn to adjust to whatever situation you are exposed to.
But for perspective, I think if you lose your temper, you're less likely to get effective assistance. So, like what Gayatri said, you need to assert at the right time. But if you can't, I mean, if you think things that cannot change, there is no other nurse available, and thing is, I think sometimes it's easier to pack and get your adrenaline down and make sure that the situation is better for them, because a lot of times I've found they respond differently to stress that way. For instance, if I ask for a particular instrument, it might be in that set, but it's easier for them to say if they know that you're going to get angry. Oh, it's not there. So you're much more likely to get it if it's there in the set, if you're not angry about it. So sometimes those deep breathing exercises do help. A bit of pranayama does help.
And
No,
also,
actually,
I'd like to add one thing, that temper has a value only if it is coming occasionally. If you're angry and shouting all the time, people are going to lose respect for it. And
Of course.
even at the correct time when you are supposed to lose your temper, people will be like, oh my God, this surgeon is always shouting. Nothing can be done about it. So those points when those escalations have to be made, they have to, for them to be effective, they should be made only at those points and not throughout the surgery or throughout all the time.
I don't know if everybody will agree on this. The most difficult thing in this world right now is to keep everybody in one place and their minds also in that place. So sometimes when they drift off and everybody is doing what they want, intentionally you may have to raise the voice just to bring them back from whichever world they are in. I find that the attention is only less than 2 hours for everybody.
Sumana, you
Everybody
don't need
gets
to raise your
lost.
voice. You got a lovely voice and quite imperious. I'm sure.
Yeah. No, but whatever it is, even if I raise my voice, all the nurses love me in the OT, so I am fine with that.
So there was like I keep going back to how Dr. Sanjay described the male surgeon and the female surgeon, and women are often described as shrews and whatnot. Does anybody have an experience regarding that, or
I
how?
think that's changing now. It was,
Yeah.
there was a time when you had to prove that you had more balls than the guys. I'm so happy that that's changing for the positive now.
Yeah.
I mean, just to give an example, Supriya was, I think, one of the first lady PGs, I think, isn't it? So I don't know. She'll tell you in private what the experience would be. I really don't know. But I'll tell you my latest when I was in AIMS Rishikesh, and I was examining a female patient, and I turn around to Deepthi and I tell her, "Can you call the nurse from outside?" So suddenly, and then she gave me a blank look. I'm here as a chaperone, and then I said, "Oh shit, sorry, So I realized that at that moment I'd actually forgotten that it was a lady rather, so I think we are reaching there from somebody who's been very conscious that, I used to give Supriya lectures on you need a family, you need this thing. So, that's the best part of my life that I enjoyed as a surgeon, I think. I think things are changing for the better. There's no doubt about that.
Yeah.
I guess
Manpreet, for the question that you asked.
the vigilantes don't need to be vigil aunties.
No, when I finished my fellowship in Pittsburgh, one of the attending, in fact, he was the program director. He said one thing to me. He said, if you want to do kidney and pancreas and all, it's okay. But if you want to be in liver transplant, you have to be a bitch, Sumana. I said. So I mean the kind of thing that is like what it is now. I'm talking about 2008-9. Now, if you see, the whole scenario has changed. In somewhere when I was in Bangalore, I was running the department in Columbia Asia. People used to say I'm a charismatic surgeon. I'm like that aggressiveness was there, and I loved it. But as you become more and more senior, and you realize that all those things are not required to do what best you can do. I mean, they are just. It's like I think it's that Grey's Anatomy. It's the those are the things which gives like a probably it's just a glamour. I don't know what it is, but eventually you will realize that all that is not required.
So to answer Manpreet's question, how much ever you may want to believe otherwise, it is very much there.
Yeah.
But there are ways to deal with it, and it is well within you. You have become a GI surgeon. You are trying to set up a transplant unit. It is well within your reach to find ways and means to tackle it. So go ahead and tackle it. You will
have
not be
to
able
be
to wish
who
it
you are.
away.
Correct.
You will not be able to wish it away, and it is very much there. But as I said, as everybody has said, there are ways and means to tackle it. Identify them and go and do what needs to be done.
No, don't feel bad of who you are. That's all I'll tell the youngsters. You have only if you become that, you'll grow and become the next person. At whatever point, if you have to even fight for it, I think I've told this to Manpreet when I met her in, I think ISG conference. Somewhere I met you and I said, no, just be who you are
I think
and what you
Srinagar
want to
right
do.
now.
Just do it. It doesn't matter. You don't care what the other person is thinking because you have to do what you know what to do best. Eventually, once you become like 10 years senior from what you are now, then you can say maybe it was not required. But at that point, it was required for you to reach that 10 years later.
And
I
I
think
would add one.
Shruti has raised her hand. Shruti, do you want to come in?
Shruti is silent.
Hi everyone. Sorry, I joined very late. I missed the meat of the talk. But just about Manpreet's query, I think one thing which I've learned is we should not acknowledge when someone is treating you differently, in like whatever you might be experiencing. Refuse to acknowledge it. Maintain your stand. You're just there as a surgeon. You don't differentiate yourself as a woman or a man. Just maintain it, and over time, I think that neutrality will seep into their minds as well. I think that's one way of doing it. And other than that, I am sorry for this. I don't know if this has been discussed already, but about the traits, whatever is being discussed is positive and negative. I think every what is perceived as a negative trait may be good in some ways, especially in a surgical field. And also, I feel the opposite people, when we are talking about subordinates, especially, or peers, I think, they are also sensible and adults enough to understand why you're doing what you're doing. They may not like it then if you're shouting at them, if you're throwing temper tantrums. Uh, they might, suck it up and deliver what you want at that point of time and hate you at that time. But I think at a later date, they will know what you did eventually was in the best interest of the patient, if that is what you intended. So I think, realistically speaking, I think we should keep these things aside, keep a broad mind, and keep doing whatever we are doing. That's all that we can do in the end.
Yeah. So thank you, Shruti. And so if I may, Dr. Sanjay, all this discussion, so many views have all come up because you made the presentation and brought out all the points so well, which forced us all to define the things in our minds as well. Sometimes we may think we know it, but it's only when you have a discussion like this or when you have a forum like this and you actually listen to others also, and somewhere you strengthen your own views and change some of them which you think need a little bit of erasing and redrawing. So thank you, sir. Thank you
Gaurav
very much.
Maheshwari has raised his hand. Sorry, ma'am, to disturb. But yeah. So
Who has
one
raised?
Hi,
Gaurav Maheshwari. Yeah.
can you hear me?
Yes.
Oh, hi. This is Gaurav actually. I'm very sorry. I think it's too late in the meeting, and I'm just wanted to paste. This is just my reflection and my experience. I'm so happy that I'm a part of this meeting. Actually, I introduced myself. I'm one of the GI surgeons. I trained in Mumbai in Jagjivan and did my DNB way back in 2012, and I was there, did my fellowship in liver transplant. Then I was working in Fortis Chandigarh, and I've recently moved to UK, and so I'm presently working in Medway in Kent in the UK. So this just a reflection which I was trying to compare because I've worked as a consultant, worked as a head of department in India. I came back when I started my practice in the UK. I worked as a registrar because I was not having a specialist register, and I had to prove my competencies to get into specialist register in GMC. And the only thing which I reflected was the one which I just wanted like to say. As a woman, I felt that there was so much of respect provided to the colleagues here in the UK, which I was frankly speaking not able to have that in India. Maybe it's changing now, but in last 2 years when I've been here, and the reason is I think from childhood, because I have a daughter, she's turning 8 now. She was 6 when I came in the UK. My son is 10. The confidence which these people provide, and this is something which I have to I think learn from this British community. They have respect for everyone. The first day when I came and I joined the hospital as a consultant, I was telling that, oh, I'm a GI surgeon to one of my nurses, and I do my upper GI surgery. I'm a robotic trained surgeon. And she very practically said, okay, I am one of the head nurses. So she wanted and expected the same amount of respect, which I was thinking that I should have as a GI surgeon. And the second thing, I just attended one of the meetings in Royal College London. They were also discussing something similar, what sort of stage women are in surgery in the UK. And the only thing is they were saying that, and I think that's a very valid point, that they have to have a very strong presentation and representation in the national meetings. So if you have every major meeting like ISG, IAGS, and they are representing something similar in the UK now, and that's what has hold me. So even I have my colleagues working with me as women, and they are almost at same par. They don't have an ego that we are the male surgeons, they're the female surgeons. That's one. And the second thing is somehow I think we've been trained like that. When I was working as a registrar, I was thinking I had always that apprehension that working after consultant, working at a registrar will be too much of a downgrading. But the amount of respect these consultants who give to their registrars is massive here. They don't feel like they are trainees. They're weak. They feel almost like maybe lots of you maybe have worked in the UK before, and maybe Dr. Sanjay has worked. But the respect trainees have here, they are just like a colleague. They have no sort of differentiation. They have the same amount of discussions which they take. And that is something which I've really learned and appreciated in this country.
Great. Thank you, Mahesh.
Thank you.
Thank you. So can we call it a day, Manpreet?
Yeah,
Yes, ma'am, I think we can.
Call it a night.
So once again, Dr. Sanjay, thank you so much for the effort. Thank you so much for your wisdom. Thank you so much for being you. We have all added years to our surgical life, watching you, somewhere learning something or the other from you. Thank you so much once again. And to all the others who participated, Dr. Puneet, I will not be able to call out everybody, but everybody who participated, thank you so much. It was not expected to be a 2-hour long webinar, I think, but it has
Yeah,
turned
I
out to be
know.
that way because everybody had an opinion, and it was nice to hear so many opinions. So thank you very much.
Thank
Thank
you
you,
and great
everyone.
job.
I think we got to learn from
Great
everybody
job.
today. Thank you, sir. It was an amazing presentation.
Thank you to
Thank
everyone,
you.
and thanks a lot for the wonderful discussion.